Hi, I'm Angela, and this is my presentation with us today about diabetes mellitus. So, a little introduction. Diabetes mellitus is just another way of saying or referring to a group of diseases usually caused by high blood sugar levels. And it's usually a risk factor for cardiovascular disease, and it has a high mortality rate. Just another way of saying or grouping together type 1 and type 2 diabetes and other types of diabetes. So data and demographic. So the average death rate in women is 20.9%, but it's usually found in older women ages 75. It's the same thing with men 75 years or older of age. It's 14.6% in men, but diabetes mellitus usually causes 102,000 deaths a year. With for 44,000 of those deaths being people older than 75. So in the human body systems, basically the way it affects the both cardiovascular system and the urinary system, the heart and blood vessels. So it can cause heart attack, stroke, or damage to blood vessels because high blood sugars can thin out arteries or veins, causing them to clog with blood, and then eventually you can have a stroke. So urinary system, it can cause kidney failure because eventually if the kidneys can't get the blood supply, they can't really do their job in clean urine. So those damaged vessels can lead to kidney disease.
Prognosis, you have to consider having strokes or kidneys disease. There's daily exercise. You have to go out and work your body out, go out for walks. You don't even have to run. Make healthy food decisions. You gotta eat healthy. And you have to do blood sugar testing. There's this machine that you poke your finger in, and it just takes blood out and it just reads it. And you have to go to frequent doctor visits or checkups. You gotta see how you're doing. And you have to take prescriptive medication from the doctor. Prevention. There's not really anything you could do to prevent this. Sometimes it just runs by genetics. But you could keep your weight normal, keep weight under control. Exercise, go out for walks, work your body out. Like I said, you don't even have to run. Be healthy, no smoking, healthy diet. Treatment. There's not really a lot of treatment. You do have to take insulin. You have to take it each day, and it's injected through your stomach on the bottom. You do have to exercise, work your body out, and self-care. Endocrinologist. Schooling, it takes about 13 years to fully become one. You do have to do a MD program to obtain a degree of Doctor of Medicine. You need a bachelor's degree mainly in biology or chemistry. You get paid about $190K to $330K per year. And the responsibilities you have is to develop treatment, to treat diabetes with diet and blood sugar, with medicine.
My biomedical professional was a diabetologist. So to be a diabetologist, you need about 10 years of schooling, 4 of medical school, 2 of medicine residency, and 2 to 3 endocrinology fellowship. And usually you need a bachelor's degree or an MD degree, which is just a doctor of medicine degree. And annually here in California, diabetologists get paid in a range, so from $99,000 to $132,000. Now, that they have quite a few responsibilities sometimes, so they can diagnose and treat patients with diabetes, with other blood sugar disorders. They come up with care plans to help them out so that they can live through their day. They help to explain them and what they need to do daily. Is just like when they need to check their blood and use a little test. When they need to poke them pills, they will teach them that. They monitor their blood sugar through checkups, whether it's like monthly checkups, just to ensure that nothing bad is going on in their blood system, or that their sugar blood levels aren't going too high. They also prescribe the medications to help them monitor or keep in a certain range their blood sugar. And they also educate the patients in case if their patients don't know what diabetes mellitus is. They will educate them on that. And yeah, the references. Thank you for listening.